Your room suddenly starts spinning, and it has nothing to do with what you ate. If you live with type 2 diabetes, this feeling might be more connected to your blood sugar than you think. Deep inside your inner ear is a tiny balance system most people never think about. And rising blood sugar can quietly damage it for years before you ever feel dizzy. Today we're breaking down exactly what vertigo is, why it's linked to type 2 diabetes, and, most importantly, how you can actually treat and manage it. Stay with me. Vertigo is not just feeling dizzy. It's a false sensation that you, or the world around you, is spinning or moving, even when you're standing completely still. Dizziness and vertigo aren't the same. Dizziness feels like lightheadedness. Vertigo is a specific spinning sensation, and that difference matters for diagnosis and treatment. There are two types: peripheral vertigo, from problems in the inner ear, the most common form, and central vertigo, from the brain itself. Diabetes mainly affects the first type. In type 2 diabetes, the body's cells stop responding properly to insulin, so sugar builds up in the blood. Over time, that excess sugar damages small blood vessels and nerves, including the ones in your ears. Research shows vestibular dysfunction, problems with the inner ear's balance system, can affect up to 70% of people living with type 2 diabetes. That's a staggering number most patients never hear about. Chronically high blood sugar damages the tiny blood vessels that nourish the inner ear, a process called microangiopathy. Starved of oxygen and nutrients, the balance organs slowly stop working properly. One major cause is BPPV, binan-paroxysmal positional vertigo. Tiny calcium crystals inside the inner ear become dislodged and drift into the wrong canal, sending false signals to your brain every time you move your head. Studies show BPPV shows up in about 46% of people with diabetes, compared to 37% of people without it. Diabetes doesn't just raise your sugar, it raises your risk of vertigo. Diabetes can also damage the nerves in your legs and feet, diabetic peripheral neuropathy. When you can't properly feel the ground beneath you, your brain loses another key input for balance, making vertigo symptoms even worse. Here's why this matters. People over 40 with diabetes for more than 5 years who feel dizzy are 12 times more likely to suffer a fall. This isn't a minor symptom, it's a real safety risk.
Researcher Dr. Linda De Silva and her team at the University of Kansas Medical Center have spent years studying this exact link, confirming that diabetes measurably damages balance function, especially when blood sugar stays high for years.
Research also found high blood pressure often works together with diabetes to trigger BPPV. Many patients with diabetes and vertigo also have uncontrolled hypertension. The two conditions compound each other. It's not only high blood sugar. When blood sugar drops too low, hypoglycemia, the brain is starved of glucose, triggering sudden dizziness, shakiness, and vertigo-like spinning sensations. Long-term diabetes can also damage the autonomic nerves that control blood pressure. Stand up too fast, and blood pressure drops suddenly, causing that head rush, room-spinning feeling doctors call orthostatic hypotension. Even some diabetes medications, like certain insulin regimens or blood pressure-lowering drugs, can list dizziness as a side effect. Always discuss any new dizziness with your doctor. It may simply mean your medication needs adjusting. Research is clear on one point. The longer diabetes goes uncontrolled, and the higher the blood sugar levels, the greater the damage to the vestibular system. Duration and control matter enormously. For millions of people with type 2 diabetes, this isn't theoretical. It's Tuesday morning in the kitchen, gripping the counter, waiting for the world to stop spinning before they can even pour their coffee. The good news? Vertigo linked to diabetes can be diagnosed and treated. The first step is always a proper medical evaluation, because the right treatment depends entirely on the exact cause. Doctors often use the Dix-Hallpike test, gently moving your head into specific positions while watching your eye movements to confirm whether BPPV is the cause of your vertigo.
Another key tool is the head impulse test, which checks how well your inner ear reflexes are working, helping doctors tell peripheral vertigo apart from more serious central causes.
Blood sugar testing and an HbA1c lab check are just as essential, because in diabetes-related vertigo, treating the root cause always starts with understanding your glucose control. Treatment for diabetes-related vertigo isn't one single fix. It's a combined approach. Let's walk through exactly what actually works, based on real clinical evidence.
Step 1 is always glycemic control, through diet, physical activity, and prescribed medication. Studies confirm that lowering and stabilizing blood sugar directly reduces vestibular and balance dysfunction over time. For BPPV specifically, doctors use the Epley maneuver, a simple series of head movements that guides those displaced crystals back to where they belong. It's often remarkably effective, sometimes in a single session.
Vestibular rehabilitation therapy, a set of guided exercises, retrains your brain to compensate for inner ear damage. For many diabetic patients, this therapy meaningfully improves balance and reduces fall risk. For persistent symptoms, doctors may prescribe medications like beta-histine to reduce vertigo intensity. These don't replace blood sugar control, they work alongside it, easing symptoms while the root cause is addressed. Since hypertension often fuels diabetic vertigo, keeping blood pressure in a healthy range is just as critical as managing blood sugar. Ask your doctor to monitor both together, not separately.
Simple home safety changes matter too. Grab bars, good lighting, and clear walkways dramatically reduce fall risk while you and your doctor manage the underlying vertigo and diabetes together.
Regular checkups with both your endocrinologist and an ear, nose, and throat specialist create the best long-term outcomes. Diabetes and vertigo are managed together, not in isolation.
To recap, high and unstable blood sugar can damage your inner ear's balance system, raise your risk of BPPV, and increase dangerous falls. But with the right glucose control and treatment, it's very manageable.
Vertigo doesn't have to control your life. With the right knowledge, the right care team, and steady blood sugar management, steady ground is absolutely within reach. If this helped you understand your body a little better, hit subscribe and tap the bell. New evidence-based videos on diabetes and your health drop every week right here on Diabetes Type 2 Reversal.